Hi there. I hope everyone is having a great day so far. So, today I'm coming to you to elaborate on a question that was asked yesterday, and that is, do all bent knees, do all of them require the knee preservation surgery that I mentioned? So, in order to elaborate on that further, I'll take you through an x ray, and I hope that will be more descriptive in order for you to understand. So, this is a standard x ray that I get done in my clinic for all those people who have pain on the inner side of the knee, like so. Next, this x ray is taken when the patient is standing, and this includes an area from top of the head and spans all the way down till the level of the ankle. So, top of the ball of the hip to the ankle. Now, my next job is to ensure that the patella, which is the kneecap, is facing forward. So, we take the x ray, ensuring that this patella, which is the kneecap, is centered in both the cases. Once we have confirmed that, what we do next is that we draw a line. This line goes from the center of the head of the hip to the center of the ankle. Now, here I have drawn two lines. And in both these cases, when I zoom in and I see the particular x ray, it shows that the line is not going from the center of the knee like it was supposed to, like here. So it should have been from along the purple line, but it is way too inside. Now, this is the reason for the patient to actually develop pain on the inner side of the knee. And this is something which needs consideration for a surgical or a non surgical procedure ahead. As you can see very clearly in both of these images, the joint space on the inner side is relatively lesser as compared to the joint space on the outer side. This overloading of the knee is the reason patients are not able to carry out their activities of daily living. Now, this depends from person to person. The spectrum is very wide. Some people will just come and tell me that I have pain on the inner side of the knee, and I'm just noticing that my walking pattern has slightly become more effortful, and also the walking speed has gone down. But when I take an x ray, I notice that the line has not deviated much further from the center of the knee. But there are patients who come waddling to me like a duck. In those cases, this orange line and this blue line, which you're seeing, will be further from the center of the knee joint. And that is the reason for the gait disturbance, the decrease in walking speed, and severe restriction of activities in their daily living. Now, when I see this x ray and I notice that the deviation is definitely there, but the joint is still very much open. So, in that case, what I would like to tell all of you is that these are the kind of patients where the deviation is somewhere in the center of the inner side, like we can see. So, this circle represents the inner side of the knee, and this line is still within the inner side. And therefore, it isn't an emergency for us to intervene surgically. And these are the kind of patients who will do very, very well, at least to begin with a good physiotherapy. Now, my physiotherapy protocol includes that they work on their quadriceps, they work on the muscles that make up the thigh above the knee and below the knee, and therefore, these patients come back to me in about 2.5, 3 months' time with much lessened knee pain. The walking style becomes more swift and it is not all that effortful. And this gives me the green signal to tell that, yes, this knee has gotten better with physiotherapy. So there's no need to surgically intervene right now. But when there is no significant improvement in their activities of daily living or in the pain profile, even after medicines, even after care measures, and even after physiotherapy, then we need to evaluate. So, this is what I wanted to share with all of you today. I hope this has been informative enough for you all to gain a bit of an awareness and share it with those who are having knee pains. And let me know if I can help further in this regard. Thank you so much. Have a great day.